Ne, to je
Way more.
Ja. Dober večer, pozdravljeni na današnji premieri filma Podzemlje, upanja. Z nami je režiser Jan Blus. V začetku sam bo povedal, je bila ideja za film oziroma za dosti krajši dokumentarec, ampak zaradi vseh zgodb se je to razvleklo. Drugače pa naj kar on pove.
Yeah, hi, my name is Jan Blus and came from Poland for this premiere of the movie The Underground of Hope. And for now I would like to invite you for the movie, and I think that after the movie we're gonna have some discussion and maybe update of the situation of the story which we showed in the movie.
Masz koło. Co to, strajk z jedzeniem? Halo?
Wszystko żadne leki. Dobrze, serdelku,
Z pacjentami z trudno leczącą się padaczką pracuję od lat. I w tym momencie widzę tragedię tych dzieci, widzę tragedię rodziców i z punktu widzenia lekarza ja nie mam praktycznie prawie żadnych wątpliwości, że jakiś super lek, który by takiemu dziecku pomógł, powinienem zastosować. Tylko że ja takich leków nie mam. W 2013 roku pojawiają się pierwsze prace dotyczące właśnie leczenia medyczną marihuaną w skrajnie trudnych przypadkach padaczki opornej nerki u dzieci. I te prace mają jednoznacznie optymistyczny wydźwięk. Stąd jakby moje zainteresowanie takim leczeniem, czy jakby czekaniem na to, kiedy można takie leczenie zacząć u nas. I właściwie czekałem na takiego pacjenta i taki pacjent się pojawił.
Poszłam do lekarzy i mówię, że proszę, jest taka możliwość. Powiedziano, że to niemożliwe, że tu nie ma takich procedur, że się nie da, poza tym to jest lek nielegalny. I doktor Bochański był jedynym lekarzem, który się zgodził nam pomóc.
Jeżeli ja nie dysponuję takim lekiem w Polsce, to jestem w stanie wystawić tak zwany wniosek o import docelowy. Ten wniosek...
Thank you for coming tonight, and in this place I would like to thanks also to Bożydar and to Lumir, Hanush, whom I interviewed in Israel, and to all Slovenian patients whom we interviewed during our visit in 2015. What can I say? As you saw in the movie, we mostly showed the events in 2015 till 2017, and today is almost the end of 2019. So I think that it's a nice thing to make small update, because in theory in Poland we have legalized medical cannabis, and each medicine could have opportunity to prescribe marijuana to patients, but still bigger part of patients in Poland treat themselves illegally. So we still have huge problem with availability of marijuana in Poland, mainly because there are a few reasons. First of all, marijuana is not grown in Poland. We import it from Canada. Only one company is allowed to do it, so this company has a monopoly. Therefore, marijuana in dispensaries, in pharmacies, is quite expensive for Polish patients. So that's the first reason. Second reason is that Polish doctors still don't have knowledge about cannabis and cannabis treatment. So yeah, even if patient want to treat themselves, it's hard to find a doctor who gonna help him. Another reason is that, Polish medicines are still afraid, because as we saw in the movie, the very first one who decided to help children with epilepsy, Marek Wachański, had serious problems. Fortunately, he didn't end up in jail, but that's the reason a lot of Polish medicines are afraid of treating with cannabis. I don't know whether some patient ended up in prison, but for sure there are, for example, oil producers who are in prison today. So oil producers in Poland, illegal oil producers in Poland, are treated as gangsters or organized crime issue. So I think that's still a problem in this field, because of course some of them are doing it for profit, but are selling quite good product, but by law and by police are treated like really dangerous criminals. So that's another problem.
This is now about the story of the movie, but we all know that Jan said that doctors doesn't have knowledge. This is true, but we are organizing scientific seminars now. Now it will be 5 years from the first one, even more. So there is no excuses anymore for doctors or professionals not to, to obtain some knowledge. But the problem is that we don't have trained staff in Europe generally. And if we want to have some trained staff, or doctors or nurses or whatever, the first results will be 10 or 12 years from now, because somebody has to end his bachelor or PhD degree, and then another 5-6 years for the first students. So even if we start today, we are already 10 years too late. This is maybe the reason why we started with this initiative of seminars. And also the problem, I agree that on the black market people can find whatever. But to control the quality of the products they use, either if they grow by themselves, if they buy it on the black market or whatever, we establish some kind of way how the people can test it. They bring it to us, we put it to the lab, and we tell them if it is good or not good. I'm talking now about products which they are using for themselves. So everything is not that bad in Slovenia, but on the field of politics, nothing will change. Because as you see, this is not the political agenda, it's a bureaucratic agenda. Because if you listen to the bureaucrats all over the Europe, they are all very concerned for children's and whatever. And just today and yesterday, I read the article, Ranital, they stopped selling Ranital because thousands of people got cancer from Ranital, but nobody gives a shit. So it's not really the concern for the health of the people, it's just the concern of the deepness of their pockets.
In Poland, we have a problem mostly with politicians who are afraid of recreational or in marijuana in general. That is why they don't let us grow cannabis in the country and don't let small companies to join the market. So they use prohibition in the same way as it was used in the 30s and 40s and 60s in the United States. So
jaz bi samo še dodal, če bi se vsi naši birokrati in politiki toliko ukvarjali, pa toliko naporov vložili v to, da bi bilo to zdravilo dostopno, kot v to, da delajo proti zdravilu, pa pišejo razne eseje na ne vem kolikih straneh, bi že to bilo rešeno. In tudi če bi politika resno mislila se za tem, nekaj vedno pride tik pred volitvami za 4 različnimi predlogi zakonov, je to malo groteskno. Tako bomo videli. Bi pa povabil še zdaj, ki ste tu, pa vsak, če povabi svojega zdravnika, da ne bo izgovoril, da se ne morejo kaj novega naučiti, na petkovo pa sobotno konferenco v hotel Union. Obvestite vsaj zdravnike, če ne vsaj, mislim, člane družine, da bodo videli in slišali direktno od ljudi, ki se s tem profesionalno ukvarjajo.
My name is Dusan Nolimal. Thank you for making this movie for public patients, doctors and others. I was enjoying the movie. My question is, what do you plan with this movie? I mean, will this movie be available for broader public in other countries and also in Slovenia for broader public?
We are now in talk with Gospodarsko razstavišče to have a two presentation on fair narava zdravja or nature and health. And I hope we will also find a way to the national television somehow. We will have our next lectures on the nature and health, and we will have lectures everywhere who will call us, maybe, you know, to educate people how to grow, because we really don't encourage people to do the cure for themselves, because it can be dangerous, and if you don't know, it's better to leave it to somebody who knows it. Legal state for our guests in Slovenia, yes, it's legal, but it's not allowed because nobody issued the recipe for the cannabis. They bought, I think, 2 kilos of weed for Slovenian only hospice, and they throw it away because expiration date. So if they don't give it even to the, you know, most severe sick people, there is no will.
Yeah, and answering the question regarding distribution, we currently we are looking for distributors across different countries. And in Poland, the movie is screened in cinemas, and I hope that the same thing gonna happen in following countries. And I think that finally it's gonna be released on VOD platforms. So yeah, that's the way we want to distribute it. First in cinemas and then online on VOD platforms.
Hi, I'm Mary. I'm not sure if I'm the best in English, but I will try. We talk about legalization in Slovenia, but my asking is if really know the doctors, politician, everything about cannabis. When I discovered 2 or 3 years ago about cannabis, I found a lot of researching. I think it's the most research plants on the planet. But when I try to go to faculty to find some books, I didn't almost find nothing. And then I ask, how can we regulate and how can we find some skills to put it in the right way, these plants, if we don't have anything on our faculty. Of course, after that, I talking with my some professors, but I think we don't do enough on the medicine faculty about this. I don't know if they start some on the pediatric clinic, something happened, but nobody knows how far is this researching. We don't know enough.
I can tell you in the name of maybe Professor Neubauer how it is. He's waiting for the sign for public National Agency for Drugs and you know, just for the sign for last 3 years. That they wanted to do some research on the pediatric pediatric clinic for neurology department, but bureaucrats, they just don't sign The paper. So he is waiting as a leading, scientist on this field, and 3 years nothing happens. So that's the answer from the bureaucrats, And this is what we want to change. I also, knowledge. Some smart guy said that knowledge is most important, and therefore we are doing these seminars or conferences. Because just on this way we spread this word through Slovenia, not just we, but also others, about the medical benefit of cannabis.
I really enjoyed your movie, but I have to say it made me really angry, because I know the stories, but those politicians and doctors and the people who are deciding about our health, about our life, it's not just cannabis, it's also the environment that's all poisoned. They're so stupid. There are no other words for this. And I guess we are some kind of stupid people as well, because we are still allowing them to rule for us. And this has to stop somehow. People who are saying that, I don't know, opioids we should be happy for in those days of crisis, they're idiots. There are no other words for this. So I hope your movie gets spread really, really wide around, so people who don't know what's happening in the field of cannabis should know. And I think we all that we know we should stop these idiots from ruling our lives. That's it. Thank you.
If the movie made you angry, I'm happy, because it was main purpose to make people angry regarding this issue. Because if people start to be angry, only then something could change. So that's the reason of making documentaries like this, in my opinion. So yeah, that was the purpose.
Še kakšno vprašanje mogoče? Če ne, bi se zahvalil vsem, ki ste prišli, zahvalil bi se tudi našim predavateljem, kar nekaj jih je tu, ki bodo v petek pa soboto z nami. Tam je dr. Grunfeld, pa profesor Lumir, magister Nolimal. Probajte še koga povabiti, ker to znanje širimo naprej. Če pa skoraj sigurno je že, ko bo naslednje projekcije 2 v konc oktobra na sejmu Narava zdravje, bo objavljeno tudi na Facebooku, pa tako vabljen tudi ja.